Good evening. Good evening. Come on in, family, to Tisa's Rants and Musings. Come on in. Let me know if you can hear me, see me. Come on in. Come on in. Come on in. Come on in. All right. Hey, family. I see folk coming in the room. Come on in. Welcome to another edition of Tisa's Rants and Musings. Hey, Kiwi. Thank you for joining. Love the faithful. Please share this to your page. Share it to your page so that we can help ourselves get better, because #healing is the only agenda. And so tonight, we're going to do some more healing work, get some more information so that we can be healed. It's 9 o'clock. Come on in, family. Please share this. Make sure you connect with me on Tisa Joyner Ministries. I'm on Instagram, Facebook, my page on Facebook. You can tell your friends they can come through on the page if they're not friends of mine. But please share this live tonight. It's sure to be informative and worthy of sharing. We have a guest tonight. Yay. So we're excited. All right. Just giving some more people a chance to come in the room. Hit me up with your, hey, Alana. Let me know you're here. Hit me up with your comments so I know you're here and can acknowledge you, at least till we get started. Thank you guys for sharing. I see you, Nikisha. Thank you, Shell Junko, for coming on in. That's my sister, y'all. Key said she was running from one Zoom to another. Yes, I was on another Facebook Live talking about racism and the pulpit. Hey, Sis Teresa, thank you for coming on in. Thank you for coming on in. Well, we don't have a whole lot of time. So, hey, Dr. Hardy, thank you for coming back. Good to have you in the space. Hey, Jamia. Yay. So sisterhood. I love the sisterhood. Sisterhood is coming on in because we are determined to be healed, to be whole, to blossom, and to manifest. Okay. So, hey, Nikisha, thank you for sharing. All right. So you guys know I got to do my intro. So we officially are beginning. Yay! It's another edition of Tisa's Rants and Musings. Last week we talked about grief, and it was so informative. And thank you guys. I'm always getting hit up in my inbox or people texting me, telling me how much of a blessing the segment was for them. So I listen, this is all to God's glory. I got on my shirt today, #minister. Okay, because if we're not about healing and helping facilitate healing, then I don't know what we're doing. We're not doing something right. So welcome to Tisa's Rants and Musing. Tonight's topic is understanding trauma. Okay, May is Mental Health Awareness Month, and so I wanted to focus on some mental health elements. Like I said, last week we talked about grief. And tonight we're going to be talking about how to understand trauma. And most of the time, when we think of trauma, we think of really big, things like sex abuse and all those other things. But trauma can happen in so many other ways. It can impact us. And if you're Black and of color, you can be experiencing community trauma, living as if we are in wartime. So trauma has so many different elements to it. I wanted to bring someone on who I knew specialized in trauma to kind of help us understand trauma more. Hey, my mama's here. Hey, mama. To help us understand trauma more so that we can, again, focus on being healed, being made whole. Sometimes we don't understand why people are doing what they're doing. We don't understand why there's certain dysfunctions in our family. And a lot of times it goes back to the trauma that people have experienced, whether individually or even in a community or both. So our guest tonight is a good friend of mine. She's on my BFF status. Her name is Kristin Miller. She's a licensed certified social worker. She has her own counseling business called Mosaic Counseling Consulting. And she's a woman of God. She loves God. She loves God's people. She has worked in communities of color especially. She goes around doing workshops on implicit biases, trying to help our other brothers and sisters understand their implicit bias. And so I appreciate that God allowed our paths to cross. And so I'm so blessed by her and who she is and what she stands for as a woman of God, and as a white woman. So, and we talk about this all the time. We have our race conversations. And so I'm grateful for who she is and the awareness that she has. And so I thought no one better than to bring on to this live tonight than my own sister, Kristin Miller. Yay!
Hi.
Hi, my sister. How are you?
I am doing well. How are you?
Good, good. So people are saying hi, Jamia.
Hi, Jamia. I am so excited to be here and so grateful for the opportunity to come together with you and everyone who's present.
Yes, yes. And we're excited to have you. So I want to give you a moment, introduce yourself. I said my portion of who you are. I didn't mention your adjunct professor at Seton Hall. I didn't mention so many things. So you can go ahead and introduce yourself. Hey, Dr. Nikki.
Sure. So I'm Kristin Miller, as Tisa said. I am a licensed clinical social worker. Most of my career was spent in a partial hospitalization program for children and adolescents in Newark, part of UMDNJ. And it was really there that I developed a much deeper understanding of what trauma is, how it shows up, what different types of trauma are and how it manifests in people's lives and in the behaviors and the symptoms that they may be experiencing. So trauma is just something that I'm really passionate about educating people about. I teach a trauma class at Seton Hall, and many of the amazing clients that I have the privilege of working with do have trauma histories. And even when they're coming in for therapy, they may be thinking, I think I just have depression, or I think I just have anxiety. But a lot of times it really is connected to unresolved trauma. And so I think it's really important to help people make those connections.
And I love how you said unresolved trauma because, and you can correct me if I'm wrong, but when I think of trauma and just doing some of the work that I've had the privilege to do, not even on a social work status, but just being doing crisis intervention, you see seemingly one trauma maybe happen after the next trauma. And it just seems like so much trauma can happen in one person's life, but it seems like sometimes it's because the previous trauma was never resolved. And so is like a carry-on, and it just becomes this perpetuation of these events in their lives. So I don't know. It's such a big topic, right?
Mhm.
And so there's so much that we can talk about, but you tell me where you want to start, and we'll just follow you.
Okay. And I think we're also open to questions if people have questions.
Thank you.
Um,
Thank you.
yeah. So I guess just starting out, just talking really basically about what is trauma, right?
Yes.
So trauma is really any experience that renders someone to feel in fear, powerless, right? And we used to think of it as something outside of the norm, but what we know now is actually that trauma is very common. And as you were saying, many adults, right? Many of our brothers and sisters that are walking around are really adults with unresolved childhood wounds. And so they think, well, that happened a really long time ago. That's in my past. And a lot of times people really aren't recognizing the way that those traumas are continuing to impact how they think about themselves, how they engage in relationships with other people. And so I think it's really important to look at trauma very broadly. So that idea that probably the three most common things that come to our mind if somebody says trauma are physical abuse, sexual abuse, domestic violence, right? But we really want to broaden people's perspective. So incarceration of a family member is a trauma. The death of a loved one is a trauma. Divorce is a trauma. Racism is a trauma, right?
Yeah.
And the list can just go on and on. Neglect, I think, is a trauma that we don't talk enough about, right? Many people grew up in households where there was emotional or physical neglect, and just the long-term impacts of those things when they're not addressed, right? Because I think one of the things we want to convey tonight is just because somebody has a trauma history doesn't mean there's no hope, right? That there is absolutely the possibility of hope and healing if people are willing to do the really difficult work.
That's good. That's good. It made me think of when you start talking about unresolved traumas that may have happened in someone's childhood. Um, it made me think of ACEs.
Yeah.
And so why don't you tell us what ACEs is all about and how it correlates to trauma?
Yeah. So ACEs, I think, is a really important and helpful topic for people to understand. So ACEs stands for Adverse Childhood Experiences. So about 20 years ago, there was a groundbreaking study done that happened by accident. So there was a doctor who was the head of an obesity clinic. And so he was noticing that as the participants in the clinic started to lose weight, that they would start to drop out. And so he became curious about this and wanted to interview some of the participants. So he accidentally asked a woman, instead of saying, "How old were you the first time you had sex?" he said, "How much did you weigh the first time you had sex?"
Wow.
And she said, 47 pounds. And she broke down in tears and she talked about sexual abuse by family members. And so this started a study that took data from over 17,000 people. And so they looked at 10 specific traumas, right? So the first ACEs study looked at things like mental illness of a parent as a trauma, substance abuse of a parent as a trauma, of course, physical abuse, sexual abuse, emotional neglect, physical neglect. And what was groundbreaking about this study is we tend to think trauma might be something that happens to other people, right? Or if it happens to us, we might think we're the only one. And what this study demonstrated was that 67% of people have at least one ACE or one adverse childhood experience before age 18. And 13% of people have 4 or more. And so it's not a stretch for us to think that people who have experienced childhood trauma would have more likelihood to have mental health challenges as adults, right? Depression, anxiety, post-traumatic stress disorder. But the other really groundbreaking thing about this study was the idea that there's also a strong correlation with physical illnesses. So
Wow.
the more illnesses someone has, the more likely that they are to have things like asthma and COPD and heart disease.
Wow.
And that literally for those people, what'd you say?
I didn't know that.
Yeah. And so for people with 4 or more ACEs, right? And I think we all know people who have had more than four or more, life expectancy is decreased by 20 years. Ooh. And so I think one of the really important things that this highlights is the impact that trauma has on our neurobiology, right? Because a lot of times, what do, right? And we can sometimes even do this as Christians, right? We know everybody is our brother and sister. We know we are called to walk in love, right? And that God is the only judge. But we can sometimes say, like, what's wrong with that person, right? Why are they acting like that? And so one of the things we really want to do within promoting mental health is to shift the question from what's wrong with that person to what happened to that person. Wow. And to really try to be compassionate, right? And what must have happened to this person if this is how they're behaving?
Wow. And that's what we would call having a trauma-informed lens, right?
Absolutely. Absolutely.
I've talked about this, and I think I've shared this with you as well, that even when we think of having a trauma-informed lens, it's not just about being in social work or social services. That, as you mentioned, even when we engage with each other as believers, when we come to church, even as a preacher, I need a trauma-informed lens so that I'm not judging people and looking at why can't they do things right, or why can't they get this, or why they don't understand certain things, or aren't where, I think they should be spiritually by now, which we can see sometimes happen in churches. We start judging people by when we think they should be somewhere in their walk. Mm-hmm. But it's the question from what's wrong with her to what happened to her. Yes. And it just reminds me of some of you guys that are on the line with us. You remember that with me when I preached a sermon about Delilah. And I think there's more to her than meets the eye, because all we're told from the biblical lens is that Delilah just was this, ratchet woman who betrayed the man who loved her for some money, and she was this prostitute, right? But no one talks about how did she get there, right? How did Delilah even end up on the margins like that? How did she end up in that space? And so oftentimes even, and looking at young girls, I remember growing up, and they would look at young girls and say, she's so fast. They would say, she looked like she looked like she don't, already has some little something, right? And they start looking at her as something's wrong with her versus that question of what happened to her. If she's 12 and she looks so sexualized, what happened? Because that shouldn't happen. That's not her just deciding one day, I want to dress like a grown woman. And, that what happened. So that's so powerful what you said. That just really hit me, how trauma-informed lens, how important a trauma-informed lens is, but then also what you were talking about, just the physiological, the neurobiology aspect to it, like how we have stuff happening to us in our bodies that we don't attribute to the trauma that we have sustained, or something I know we've talked about before, which is trauma residue. Tell us a little bit about that, please.
Yeah. So trauma residue is really the idea that we can be out of the situation or the long-term situations that caused the trauma, and the residue can still be on us, right? Whether that's about the way that we think, whether that's the way that we engage in relationships, right? Whether that is the way that we parent, right? It
Wow.
impacts so many things. And so with trauma, of course, we want to look at intergenerational trauma, right? Because sometimes that residue, right? If grandma has unresolved trauma and she's parenting, right, out of her unresolved trauma, doing the best she can,
Doing the
but
best.
unresolved trauma, then it just keeps getting passed down and passed down. So I think part of healing is really, right, because what happens with trauma is oftentimes people, because it is so painful, right, to think about and to process through, that a lot of times people just disconnect from it, right, and just avoid it completely,
Yeah.
or they're doing things to numb it, right? And not connecting that this is a trauma residue. So we see a lot of numbing of trauma. And it's not because people don't want to get better. It's because the work is really hard and it's really painful for us
Yes.
to sit with and acknowledge what has happened to us.
Yes. Because when you acknowledge it, then it almost gives you a sense of responsibility and I have to do something about it. And it's
Mm-hmm.
hard. That's this hard stuff that we're talking about. And I love how you talked about if grandma has unresolved trauma, because it reminds me of when I used to be a foster care caseworker, and we would do a lot of kinship homes, right? So mom would be on drugs, but then we would go place the children with grandma. But
Right.
oftentimes we never helped assess in that family if mom's drug addiction was tied to grandma's trauma. And
Yes.
that happened then to that child, which made
Yeah.
them go and self-medicate and numb. And so now we're placing another child with grandma who's, like you said, trying to do her best. But if grandma
Mm-hmm.
never resolved her trauma, then we're
Right.
still perpetuating this cycle of trauma residue
Yeah.
like this on these generations, moving on. And to just talk about the fact that, or to just acknowledge how hard it is to actually acknowledge and talk about trauma and do the work of healing, which is why this is what I feel God has, I didn't ask for it, but it's kind of called me to. The hashtag healing is the only agenda, and it's taken
Yes.
on its own, thing now, because,
Yeah.
God's will for us is to be
Yeah.
healed and made whole. Wilt thou
Yeah.
be made whole? We do
Yeah.
not have to keep perpetuating and living beneath our privilege and what God has for us because
Right.
of what has happened to us in our past.
Right.
So healing is possible, but first
Yeah.
we have to understand how we even got to where we are, right? We
Yes.
have to understand what those traumatic events that still have residue on us. Some of us have married out of the residue of our trauma
Yes.
and
Absolutely.
don't understand how we ended up with someone just like our abusive dad, let's say, right?
Right.
Making up examples. We end up in relationship after relationship that looks like the previous relationship, that then if we really sat down and thought about it, looks after what we saw growing up or some trauma that might have happened. So it's so layered and it's so much to it. Tell us a little bit more though about how that how to deal with being able to recognize it, because I know it elicits a lot of guilt, it elicits a lot of shame.
Mm-hmm.
Maybe you can talk, because I want us to, those who are viewing, to be able to start on this journey, right?
Mm-hmm.
If they realize
Yeah.
that there's unresolved trauma in their life, let's normalize some of that reaction that they may have coming to that realization.
Yeah. So I think if we think about trauma, right, some of the common symptoms that people may experience, right? So some of the symptoms are really about avoidance. So avoiding people, places, or things that remind them of the trauma. It can be things like flashbacks of things that have happened, right? Or having nightmares about things that have happened. A lot of times it does impact somebody's thoughts, right? Both thoughts about themselves as well as thoughts about relationships, safety in the world, right? So it's very common for some of the trauma residue to be thoughts like everything is my fault, right? Or I'm not good enough, or I'm worthless. My needs are not important, right? If you think about a child growing up in an abusive home, we're
Right.
never about them, right? It's never about their needs. So these are some of the really common themes. I can't trust people, right? A lot of times people who struggle with people-pleasing behaviors, that can really originate from
Wow.
Mhm. What other symptoms?
Wow.
Just things not being able to really experience a lot of happiness or joy, just feeling like you don't really get pleasure out of anything in life. It can be feeling disconnected from your body, or disconnected from your life in general. And in relationships, it can show up again as the people pleasing, but it can also show up in very volatile attachments in relationships. So, for example, something that's very common in people with unresolved trauma is what in therapy we call, I hate you, don't leave me, right? So you want to connect with the person, but you've never really had a healthy connection. So then that makes you uncomfortable, and then you disconnect. So there's kind of this connect, disconnect, connect, disconnect. And a lot of sabotaging in relationship. Because again, if I think back to what you were saying that was so powerful about healing, right? Healing is painful, right? And healing requires growth. So I think one of the things that's really important to remember with trauma survivors is it's not that people don't want the healing, right? But we have to choose every day between growth and comfort, right? So if we're comfortable, we're not growing. If we're growing, we're not comfortable. And so people with unresolved trauma histories, not because they want to, right? But we all tend to gravitate towards what's comfortable.
Right.
So if I grew up in a really chaotic household, now I'm going to be uncomfortable with people who are treating me well. Right? In a relationship that like safety is going to feel unfamiliar to me. So I'm going to be drawn to people, places, and things that are familiar, right? Because there's something that just feels safer about that. Like I know that it's unpredictable if I have an unresolved trauma history and now somebody is just treating me well and trying to engage in a healthy way with me. And I think the other trauma symptom that I do think is important to mention is irritability, because I think a lot of times, especially when we're talking about children and adolescents, but even adults, right? And especially if we're talking about youth and adults of color, there's this tendency to label people, right, as being angry or having an attitude, right? And I think, again, that question of what happened to this person, a lot of times that acting out is really a trauma reaction based on things that have happened.
I don't know, I'm getting a little bit of a delay, and it seems like it's a little story on else because this is just too powerful. Please, please, please share this. Share this with on your page. Tag people that you know can use some healing, that possibly could still be suffering from unresolved trauma. Because listen, we can't afford it. Looking broke down and unhealed is not cute anymore. Okay, healing is what's up. Healing is the only agenda. We can't afford it. It's too expensive. It's costing us lives. It's costing us so many things in our community. I wanted to say something, and you talked about just sometimes the choosing between the comfort and growing and all of this. It's just it's so real, right? And I know we talked about sometimes we get stuck with feeling guilty about the things that have happened to us that then elicits shame, right? And understanding guilt and shame and kind of normalizing it so that it doesn't stop us. Like, how do we move past feeling the guilt, feeling the shame about it, to then go ahead and start moving onto the journey of healing, right?
Mm-hmm. Yeah, so I think in order for us to be able to process through feelings, something that I think is really hard for most people to do nowadays is we need to slow down, right? How do I even heal from the trauma residue, the trauma thoughts, the trauma feelings, if I never slow down enough to even recognize what am I feeling? What am I feeling? Right? And we live in a society now that is so fast paced, right? And there's just constant distractions, constant ways to check out. And so I think if we stand on God's word that he works all things together for our good, right? I believe that one of the good things that's coming from this pandemic is the slowing down, right? Because that really is necessary to the healing, is to really, so I think that's an important part of the work, just starting to really, even if you just sit for 5-10 minutes a day and check in with yourself. What am I thinking? What am I feeling? What's going on in my body, right? Because if I don't know how I'm feeling, then I can't heal it, right? I can't do the work.
It's true.
So, go ahead.
So I want to acknowledge so many social workers who have joined in. You have a student that has commented about how your teaching has blessed their lives and taught them so much. We have Pastor Dow on. We have Dr. Kirk Johnson, who also wrote a book. Let me show you his book. He wrote called Medical Stigmata. So if you haven't gotten that, it's another good one. It's about race medicine, the pursuit of theological liberation. So shout out to Dr. Kirk Johnson on with us tonight, as well as Dr. Cheryl Hardy. And then I got my mama who's been a social worker, has been a social worker for 35 years. And when you talked about mourning, and you talked about us not stopping to recognize that we are wounded and have been traumatized, but we tend to still want to medicate. And so it made me think of the work that she's done all those years with addiction counseling. She was a KSAC, and so she worked with people suffering from addiction. And a lot of times, the addiction is only the symptom of the trauma, is what they've been using to help them cope with some of the stuff that they've been through. And so I had Dr. Nikki on here as well, who's a social worker. So many have chimed in, and I know they're all like, I wish we could have more because I know they're chomping at the bits, like, say this and add that and do this. But it's been such a good conversation, and you're telling us so much. So I think that whole idea of stopping, right, and recognizing what we are dealing with in our own lives, owning that, I have some unresolved trauma, owning that
Yes.
some of my lack of forgiveness, some of this hard exterior, some of these reactions. We didn't talk about fight, flight, freeze, right? Some of these
Mhm.
reactions in our bodies are
Yeah.
linked to some of the abuses or the trauma that we've had that we haven't processed.
Yes.
And so then we're walking around with this trauma residue on us, and we're not necessarily able to experience the life God has for us because we're stuck in that world. Um, and I guess I'm trying to figure out, um, when it comes down to seeking help. I believe, and I think Dr. Cheryl Hardy said this last week, and she posted all the time, that God in therapy, right? God in therapy, God in therapy, because sometimes we think we can just do these things on our own, and then it overwhelms us, and we like, okay, I can't, it's too much. And so we give
Yeah.
up on the healing journey because we're kind of doing it on our own, or we're just using our girlfriends to try to help us process things,
Mhm.
and they're not qualified to process some of this stuff with us. They're just
Right.
as traumatized as we are, and sometimes worse.
Yeah.
So we're talking about it, and this is what, and I love women's conferences. I love, these
Mhm.
kind of gatherings, but I'm always been an advocate of, you need professional people on hand, because you
Mhm.
can't trigger their trauma, and then there's no one to really help them process it outside of praying for them. So
Yeah.
God in therapy is a powerful combination. You can have Christ on the
Absolutely.
couch. I heard someone say, and you need to sometimes though recognize that if you've had certain traumas, it's going to take some time to heal from.
Yeah.
It is not an overnight process. But listen, if it can give you one less night of anxiety, one less
Yeah.
night of being in a relationship that you have no business being in, because it's just
Mhm.
like the last relationship and you have a pattern of being with abusive people. Like, it's
Right.
worth it. It's worth
Yeah.
fighting for your life. This is our
Yeah.
lives we're talking about. Oftentimes, when we think of our lives, we're only thinking of being alive, but not being able to thrive. And so many of
Yeah.
us are just living and not
Yeah.
thriving because we
Yeah.
haven't processed this stuff. So I
Mhm.
tell me, and I know you deal with you're a Christian counselor, which so many of us have had a hard time finding, someone who
Mhm.
comes from a faith perspective or even allows faith into the space,
Yes.
right? So why don't you just tell us, like, what to look for in a good therapist? I mean, we know we're going to put you out there, Dr. Show's out there, but for people who are looking to maybe talk to somebody, what should they look for?
Mhm. Yes, and I'm going to give a plug to the two Christian therapists that I just hired. One is a
Yeah.
member of my church, and one is a former supervisee. They're both outstanding women of God and women of color. Um, and so I think in terms of looking for a therapist, number one, it needs to be somebody that you're going to feel comfortable with, right? And so any of your preferences are okay, right? Some people only want to go to a female therapist or only a male therapist, right? If a person of color may sometimes have a preference of, I'm going to feel most comfortable with a person of color, right? For many Christians, it is important, right, for them to go to someone where um, they are able to speak freely. Like, I'm thinking of a session I had recently where my client said, "Oh, thank God you're a Christian, because I think if you weren't, you'd probably be trying to send me to the hospital." Right? Because like things that we would talk about from in the spirit, from a spiritual perspective, and demonic influences,
Right.
right? If you talk to a non-Christian therapist, they might be like, "Oh, I think she's hearing voices," and those kinds of things. So um, I think I would encourage people, when you call, ask questions, right? You interview the therapist. The therapist works for you, right? This is your healing journey. So I encourage people to ask a lot of questions. What approach do you take? How many years experience do you have? What are your areas of expertise? Because any therapist that says to you, oh, I just work with anybody, that's not a good therapist, right? There's no way, because there's no way that I would have training, expertise, experience in every area of mental health, right? And I'll sometimes people call me who have trauma, but they also have substance. Right. And so on the phone, you know, I'll do a phone screening and I'll say, you know what, I don't think I'm the best fit for you. Well, but I really want to work with you. And I'm saying, but I don't have the substance training, right? So it would be actually inappropriate for me to, oh no, I'll just work with anybody. So I think that piece is important. And so obviously for non-believers, you know, who don't want Christianity brought into the therapy space, then we're respecting that, right? We're not trying to bring it in. But for believers, it just adds such a powerful layer to and it's really up to each individual person. I have some people that want to start or end the session with prayer. But we're definitely, so we bring as much or as little as each person wants in their walk. So I think just asking a lot of questions and just making sure I don't even want to say comfortable, because therapy is uncomfortable, right? It's talking about challenging things. So a lot of times I'll get people calling me that have been in therapy previously, and they'll say, my therapist was really nice, right? Very supportive and empathic, which of course is important, but they kind of just yes me. And they're not pushing and challenging me. So I think that's an important question to ask. Because if I just want somebody to yes me, I can just call a friend, right? So therapists should also challenge. But I think it's important for people to also understand therapy is not a lot of advice giving, right? Because I believe you're the expert on your life. You know what's ultimately going to be most helpful to you. So really my job as a therapist is to join you on your healing journey, to be asking questions to help you think about things differently, understand things differently, look at different perspectives. Let's look at your options, but it's not my place to say, well, you know, you need to do that. Right.
And that's what people look like, right? That's what they look for, rather. They're looking for someone to just tell me what to do so I go do it, because it makes it easier. If I could just follow these guidelines, check off what I've done them, yay, I'm healed. Yay. I've conquered trauma. And I can stop going to therapy. And they keep wanting the therapist to tell them what to do. So it makes it easier. But really, the role of the therapist is to be a facilitator. Right? To facilitate those aha moments for people to recognize, oh, I didn't know this all along. Because most of us don't believe we know what's good for our lives. We don't think we know. Actually, some of us, we made a mess of it, we think, right? So we're like, surely I don't got the answers. Have you seen my life? Okay. So we don't trust ourselves. We don't believe we know what we know about ourselves, but so much of what we know is laden in guilt and shame and trauma residue that a therapist helps us uncover and kind of, to me, cleanse off all of that residue and come out with this fresh perspective of not just life, but who we are and what we're capable of. It's such an empowering process to me. When I think of self-care, I think of being able to delve into what is going on for me so that I can be my best self. You know, we love to say, you know, oh, I'm living my best life. We're not here. We're not living our best life. We think because we have some good things happening, that's as good as it gets. But if we're still living with trauma residue and still, you know, living with dysfunction in our families, still living with, you know, just not understanding why we do the things that we do, we haven't really even begun to live.
Yes.
Absolutely. That he came that we might have life and have it more abundantly. So healing is the children's bread. Healing is our portion. We don't have to stay in the space that we're in. The Potter wants to put us back together again. Oh, Kristin, thank you so much. Yay!
You are so welcome. Can I just add one other thing just about therapy?
Sure.
So I think the other important pieces that happen in therapy are also providing a lot of education, right? So educating somebody about whatever issues they're coming in with. So educating about trauma and how that shows up, the neurobiology of trauma. And again, at Mosaic Counseling, it's really a very collaborative process, right? So if somebody wants to focus more on coping skills, right? Or how do I set better boundaries in my relationships, right? So part of it is really skills, right? Teaching skills that people can apply in their lives as well.
Tell us, how can we, if people want to get in touch with Mosaic Counseling, where are you located? Are you taking new clients?
Mm-hmm. Yeah, so in terms of physical offices, we see people in 2 locations, one in Saddlebrook and one in Springfield. Right now, we are all telehealth, so we are not in the office right now.
Braving COVID to help people heal.
Yeah. So we are doing video sessions over a HIPAA compliant platform. And so if people want to reach out, will you put something on your page? People are welcome to either, I think you might put up my email, my phone number. So absolutely, people are welcome to reach out if you're looking for therapy, or even if you just have a follow-up question for me based on some of the things we've discussed. It's really important to me for people to have just a better understanding of trauma and how it's impacting them. So yeah.
Thank you so much, Kristin. This was fantastic. I really think that we have space for a part 2. Because
okay, I'm in.
Bring it on. Okay, so I just think we might be able to squeeze a part 2 out of you. You guys comment part two if you think we can do a part 2, and I'll know for sure whether we should go with that or not. Thank you to everyone that tuned in.
Yes.
I appreciate you guys being here. Listen, all we can do is try to help each other. We're in this together. We are not in this by ourselves. You are not alone. You are on a healing journey with different ones. This is a community that I'm creating and developing that's coming into this space because #healing is the only agenda. So Thank you guys. Share this again. Tell your people to connect with me on Tisa Join the Nance Ministries. They can join that page. And we'll be back to, next week. Same bad channel, same bad time, and maybe with the same guest for a part 2. I might have to do some rearranging. Okay. Thank you guys. God bless you all.
God bless.
Thank you, Kristin.